Today is Friday. This is our end of the week update on our COVID numbers, and we'll also give you some updates about our vaccine clinics that are coming up. So in the last 24 hours, we've had a cumulative number of cases of 37,269. That's up 67. However, that increase is elevated beyond what the real numbers are due to some labs that have had some delayed reportings. We have been averaging about 30 or so cases per day, and that's been pretty consistent on this last plateau. The number of hospitalized individuals is up 9 to 4,774, and our mortality is up by 5 to 776. In terms of currently hospitalized, here in Mobile County, we are at 34. That's down 2 over the last 24 hours, and these are record lows with respect to those that are in the hospital with respect to COVID-19. So what we are continuing to see with these numbers are consistently low numbers that are approaching the lowest that we've had throughout the pandemic, which is incredibly encouraging. So we are going in the right direction. Please continue to do what you've been doing, which is wearing your mask, socially distancing, and seeking vaccination when it's available. That is probably right now the most critical aspect of getting out of this pandemic. Just a couple of vaccine updates before I get to the questions. So you'll see over the next 2 weeks here at Mobile County Health Department, as well as other distributors of COVID-19 vaccines, just these big push campaigns to get COVID-19 vaccine out. And that is the result of more vaccine now becoming available through not only the Alabama Department of Public Health, but also the federal disbursement of vaccines through several different areas of access. So as more and more locations come online, we also are going to see the National Guard start to deploy and to administer in areas that are not in Mobile County, but you're starting to see now where the pipelines are opening up for distribution with these vaccines. So the supplies of Moderna and Pfizer are looking very promising. Johnson & Johnson is still in the ramp-up phase for their vaccine distribution. We had an initial allocation, and we'll get small little allocations as we go, but you're not going to see big numbers of vaccines from Johnson & Johnson probably for the next 30 to 60 days as they ramp up their production. All right, so this coming week, we, Mobile County Health Department, are holding 2 very large vaccine events. The first one is Monday, March 22nd, and this coincides with the expanded eligibility here in the state of Alabama. So Monday, individuals that are 55 years of age and older are now eligible for vaccination. For me, those individuals that are 18 to 54 with underlying health conditions are now also eligible for vaccinations. So we are now being able to get into expanded populations for vaccine availability. You'll notice that I said 18 to 54. That is for Moderna. If you are at a location that is using Pfizer, then the lower age cutoff is at 16 if you have underlying healthcare issues. The other thing that will happen Monday with the expansion, the third expansion, is into some additional occupational elements. So if you are questioning whether you now meet some of these new eligibility criteria, you can consult the Alabama Department of Public Health website, or you can go on to mchdcares.com, and we actually have an eligibility tracker that you can put in your information and determine if you're eligible for vaccine. So With the new eligibility coming Monday, we are doing one of the largest clinics we have ever done here at Mobile County Health Department. We are going to be at the Mobile, Alabama Cruise Terminal from 8 a.m. to 8 p.m. We are going to have well over 1,200 vaccines available for use. So in the past, we have stopped at 11:30 because we have given all the vaccines we've had for that day. That will not be the case on Monday. So please, if you're in the area, you meet the new eligibility criteria, please come to the Mobile, Alabama Cruise Terminal. We'll be doing a first dose vaccine clinic that day. And again, using Pfizer. So Monday 22nd, 8 a.m. to 8 p.m., Mobile, Alabama Cruise Terminal, first doses with Pfizer. Then the next day, on March 23rd, we're going to be down at Bala Battery at Bellingraph Gardens and Homes, and we're doing a drive-through clinic there. And our times there will be from, help me, James, 9 a.m. until our vaccine supply is exhausted. So if you're in the area, please come down and take advantage of these opportunities to be vaccinated. We are also going to do a second dose vaccine clinic on Thursday of next week at the Mobile, Alabama Cruise Terminal. So if you are now coming up on your second dose, and if we vaccinated you, we being Mobile County Health Department, using Moderna, then check your CDC card to see if you're coming up on your 28-day second dose window. So we do have some other vaccine clinics that are planned. If you would, check that website, mchdcares.com, for additional information and for schedules. We'll also be doing some live updates on Monday throughout the day, just to let everybody know how we're doing in terms of vaccine supply and what's still available there. Okay. The next thing that I should mention is you're going to start seeing some changes with respect to some of the risk reduction measures around COVID-19. So there are data now that are coming out of CDC that are reducing the social distancing from 6 feet to 3 feet. That actually is based on new clinical trial information where they are studying the transmission dynamics, and it appears based on the most recent data that 3 foot distancing is equivalent to 6 foot, meaning you don't get that much more reduction in transmission at 6 foot compared to 3 foot. I will remind you, though, that masks are still required, and it's the masking that is really playing a big part in this reduction of the need for social distancing. There are some other really exciting information as well coming out that will be updated with respect to reducing restrictions in nursing homes. And again, this all goes back to more data coming in, and those data informing decisions in terms of public policy with respect to COVID-19. All righty. So let me get to a couple of questions here. So we had a media question. Thoughts in general of the new guidelines of only requiring 3 foot of distance in schools as long as masks are being worn. What has happened over the course of the vaccine pandemic is early on, we did not have a lot of data with respect to disease transmission, viral transmission, mass dynamics, viral flow, et cetera, et cetera. And what you're starting to see is more information becoming available through trials that better informs decision making. So that reduction from 6 foot to 3 foot is based on clinical studies and looking at the difference between viral transmission at 6 feet versus 3 feet. And it appears that 3 feet, which is what WHO was recommending in Europe all along, is sufficient for viral transmission reduction in conjunction with masking. So that's an important caveat here. So in terms of concerns with these guidelines, actually the concerns here are less so than they were before, because more and more of these public policy recommendations are being guided by data that are coming in now through the trials. So we are being better informed from science as opposed to looking at what we think we know and being the most conservative as possible. So there should not be any concern on parents' parts here. This is well grounded in the science, and it's factually based on the available data. And in terms of, is this the first wave of changes before socially distancing goes away or masking goes away? So there's a lot of dynamics that go into that question. So what we're seeing now is a progressive decrease in the numbers. We're getting better data in. We're getting more people vaccinated. And as long as we keep the caveats in mind, meaning we still need to make sure we're doing these things, we're only about 20% to target with respect to herd immunity. And that threshold is very, very important to keep in mind. We're now seeing increases in areas like Mississippi and Florida that kind of threw away a lot of these and jumped in with both feet, kind of unabandoned. And it needs to be a gradual reduction around these guidelines. So yes, these guidelines will start to loosen up as long as we don't abandon all of these mitigation activities too soon. So I only had one social media question. It was around being diagnosed with COVID-19 and receiving monoclonal antibody treatment and eligibility for vaccines. So the only two medical treatment contraindications, meaning we will not vaccinate you, is if you have had monoclonal antibody treatment or convalescent plasma treatment for COVID-19 in the last 90 days. The reason why is those two treatments essentially will wipe through the vaccine once it's injected into your body. So we might as well have taken that vaccine and just dumped it out on the floor because your immune system will clear it. So please be patient. You will have natural immunity for at least 90 days here. So 90 days from the point that you finished your treatment for convalescent plasma, then you are then eligible for the COVID-19 vaccination. I mentioned contraindications here too. So the medical conditions that are contraindicated for COVID-19 kind of fall into three buckets. So the first bucket is straight up contraindicated. You should not be vaccinated. That is, if you have had a immediate hyperimmune response, anaphylaxis response to one of the first doses of these vaccines or one of the components. So that's why we watch you after we vaccinate you. But if you've had an experience like that with Pfizer or Moderna, you should not be vaccinated the second time around, okay? The caution area, so that's the middle one. So normally we watch individuals for 15 minutes, but if you've ever had a reaction to a vaccine that has a component of one of the Pfizer or Moderna vaccines, and you've kind of had a hypersensitivity reaction to that, not severe, but a little bit of an immune reaction. And let me say the component in these vaccines where some people are a little bit allergic to is polyethylene glycol. And it's in a lot of things, but it is a stabilizing component in the vaccines. And if you've had one of these slight immune reactions, we're going to ask you to wait 30 minutes and let us watch you to make sure that everything's okay. The last column, which is you are okay to be vaccinated, is, well, I've got food allergies, or I've had a slight reaction to a vaccine ever in my life that may have been an influenza vaccination, which is based on eggs. So those are not really concerning to us. Family histories of allergy, reactions to oral medications, that type of things, you're clear to be vaccinated. Also, a lot of people get confused about these new eligibility underlying conditions of cancer and being immune suppressed as saying I can't be vaccinated. That's not the case. You guys are part of this new eligibility wherein you really need to be vaccinated because your underlying conditions plus COVID-19 can end up in poor outcomes, can result in poor outcomes. Okay. I will also say, last thing about this, if you've got a complicated medical history, meaning, lots of bypasses, a lot going on, metabolic syndrome, etc., consult with your healthcare provider and just be really, really clear with them that you want to get the vaccine and make sure they clear you for that, okay? Because everybody is different and there are certain overly complicated medical conditions wherein you may want to wait a little longer to be vaccinated if your immune system is not where it could be if you waited a little longer before getting the vaccine. So this is really where your healthcare provider comes in with respect to giving guidance on being vaccinated. All right. So James, that's all I have. Anything that came through? All right, good deal. So hey, come see us at the Mobile, Alabama Cruise Terminal on Monday. We'll also be back here for the expanded report on the COVID-19 numbers on Facebook Live. And then come see us at Bellingrath Gardens on Tuesday, starting at 9 a.m. until our vaccine supply is exhausted there. So thank you very much.